Good evening, and welcome to Doctors on Call. I'm Dr. Ann Stephen, a pediatrician and chief medical officer in the East with Essentia Health, and I am your host for our program tonight on vaping, tobacco use, and smoking cessation. The success of this program depends on our viewers, so please call in your questions on smoking, tobacco, and vaping-related problems, and we will do our best to answer them. The telephone numbers for your questions can be found at the bottom of your screen. Our panelists this evening include Dr. Elisabeth Bilden, an emergency medicine physician with Essentia Health St. Mary's Medical Center. Dr. Jason Wall is a family medicine physician with Essentia Health and faculty member at the Duluth Family Medicine Residency Program. And Dr. John Wood, a family medicine physician with Essentia Health and program director of the Duluth Family Medicine Residency Program. Our medical students answering phones tonight are Wade Diostin from Marshall, Minnesota, Amy Larson of Wilmar, Minnesota, and Alex Swooner from Grand Rapids, Minnesota. And now, on to tonight's program. Well, thank you for joining us this evening to talk about this really important topic. While we're waiting for some of the questions from our callers, maybe you could give us some statistics that kind of set the background for the importance of our discussion.
Thank you, Dr. Stephen. Well, I'd just like to start off by talking first about e-cigarettes. I guess I'll just focus on that in a couple of seconds. E-cigarettes were essentially invented in 2003 by a Chinese researcher. His dad had died of lung cancer and he wanted to create a smokeless form of tobacco. And so in 2002, none of us had heard of these. 2003, somewhere in Far East, they started to use, and now it's been an explosion though in the past few years. In 2018, in the state of Minnesota, 1 in 4 high school students was using e-cigarette tobaccos, e-cigarette products. Certain parts of Minnesota up on the range, it's 1 in 3. Down out in Detroit Lakes and Becker County, it's 1 in 2. So the numbers are such that the CDC, Surgeon General, has called this an epidemic.
So 50%, these are high school students
High school
you're
students.
referring to?
25, 1 in 4 are high school students.
Well, up to Becker County.
Yeah, in Becker County, 1 in 2, 50%.
Mm-hmm. Oh. Well, that's really frightening to hear about that. And that's a big difference in the tobacco use in general, right? Amongst teenagers, we're not seeing tobacco use. It was actually falling rather than rising up until fairly recently. Mm-hmm.
And one more thing, and then the scary thing about the e-cigarettes is that the nicotine content, although you can argue how much nicotine is actually being delivered to the lungs, but in this product, which is available at probably gotten at East High School, I believe. Some of this stuff was basically confiscated at East High School, so that's how common this is. It's everywhere. 50 milligrams per milliliter of nicotine, and in a pack of cigarettes, there's probably about 21 milligrams. Mm-hmm. I'm not saying all this nicotine goes into the bloodstream, but it's certainly present. So thank you.
Yeah, I was actually having a conversation today with some physicians who were talking about helping patients, supporting them in the hospital who are going through withdrawal because they need to stay in the hospital, and how the usual doses of pills or patches weren't working. Would you like to comment on that? Have you seen that?
So the part of what I do is medical toxicology in a hospital setting. So and only in a hospital setting. So yes, the amount that somebody uses is much more than what's contained in even the largest content dose pack of the patch. Yeah.
Oh, goodness. Have you had a lot of people come to you asking you whether or not you can help them to stop vaping at all? Or, I mean, I'm not hearing a lot of people who want to quit vaping yet. I'm finding that a little bit concerning.
No, most people have the impression that somehow it is less harmful than traditional tobacco use. And of course, that's a huge question and a big what if. And like many things, our response is best avoid it. We don't know of any safe level of nicotine use, and particularly when there's no FDA regulation for any of these products. And the doses range from no nicotine to doses that can cause seizures when used frequently. So.
And that guidance is provided by the CDC, the Minnesota Department of Health, and so those are some really good resources for folks. They have both healthcare and also public information on their websites. And one of the things in terms of the statistics is, so in the United States, it's over 2,600 cases that are reported hospitalized patients with 60 deaths in all states, DC, and 2 U.S. territories. And in Minnesota, 141 patients that are, this is attributed to that, with 16 still under investigation and 3 deaths, with one
Specifically for vaping. Oh.
Yes, vaping-related lung illness.
Dr. Wood, have you found that, this question comes from Alex in Duluth, have you found that vaping helps smoking cessation or reinforces the habit?
Alex, that's a great question. It's very controversial, at least among certain subsets of our population. It's interesting. In England, vaping or e-cigarettes are touted as a way for people to stop smoking, and I think the big reason it's different over in the UK is that in Britain they regulate the amount of nicotine. The Department of Health, I forget what it's called, British Health Service, 20 milligrams per milliliter is the maximum amount of nicotine you can have over in the UK. And so the amount of nicotine is controlled, and so as a result of that, people are very successful in using e-cigarettes as a smoking cessation. It's marketed very differently here, of course. And so anecdotally, I have certainly talked to people who have told me that use of e-cigarettes is successful in smoking, but I can tell you that there's lots of other methods that have been proven, FDA approved and monitored, and you'll be a lot more successful. You really don't have any way of knowing how much nicotine is in a vaping product and how much is getting delivered into your bloodstream. You just have no way of knowing that.
Dr. Wall, this question comes from Gary in Grand Rapids. Is the nicotine in e-cigarette as addictive as cigarettes?
Thanks for the question, Gary. Yes, nicotine is nicotine. The golden question here is how do you know you're getting nicotine, and what else may you be getting in addition to the nicotine? The classic examples would be you can get the, it's associated with the popcorn, the microwave popcorn. Diacetyl can be damaging, and so when the combustion occurs, sometimes there's diacetyl in these compounds, and that can cause the same injury to the lungs that occurred in people that were manufacturing the microwave popcorn bags. And of course there are other untoward, unexpected, like the vitamin E acetate that's associated with the vaping lung injury. So, no regulation. You could say that if you knew it was nicotine and you knew it was at a specific amount and it could be used much like an FDA-approved Nicotrol inhaler that allowed you to taper down the amount of nicotine you used, theoretically speaking, that would be safer and potentially a nice pathway or roadway to quitting, but we just don't know. Mm-hmm. And so not knowing, and then if you look at some of the other products that are laced with, synthetic cannabinoids or THC and a lot of other just heavy metals in general, it's a gamble.
Dr. Bilden, this is from Wade in Duluth. Do we know if there's a connection between vaping and cancer?
We don't have statistics or research to say that there's a causation. And that was actually how vaping was FDA approved. Mm-hmm. The approval was given because the thought is we don't have evidence to support that it causes cancer. The problem with that is we don't have evidence to say that it doesn't. So it just has not been
soon.
Right, especially that we have different organizations that regulate that and say what that is, those that define that in the US. So mm-hmm. It's not been as used as often. And I think it's a really good point that in general, when you use something, especially from informal sources off of the internet, that you don't know what you're getting. Mm-hmm. So different things in different components, and that goes for substances even in addition to vaping.
Thank you. These two questions have some crossover. Amy in Duluth is asking, what are the dangers of vaping? And we've hit upon a few of those already. But then this one, it would also be a potential danger. Sherelle in Gilbert says, do the fibers from the filters on e-cigarettes cause cancer, or what are the effects? Can you comment on additional dangers and whether, I'm not familiar with the filters on the e-cigarettes.
I actually don't know. I know the batteries can explode from time to time and have killed people. I know that much, one person in Texas. But I honestly don't know. Maybe Dr. Bilden or Dr. Wall, I don't. And for one thing, too, the data for cancer wouldn't be, they haven't been studied long enough to know that. But I don't know.
Well, certainly you could comment on some of the dangers.
Some of the dangers, and specifically to the filters, we can't speak about cancer, but the process is, it's a fairly high heat that's used, and depending on which device is used. And when we talk about vaping, different from combustion, which is regular cigarettes and particulate matter, this is more sort of chemicals and much smaller, if any, particles. It's really a vapor or a gas. So the bottom line, that's acute. The heat can actually be a problem, and then the chemicals that are in it. With regard to the actual filters, I don't know. And then in general, the injury is, there are a couple of things, but the main thing that has become the epidemic, in addition to, well, an epidemic is the vaping, but the result of that is the E-valley, which is the lung injury essentially associated with vaping products. And so that has put a number of folks in the hospital. It's also the out-of-hospital setting that it can cause shortness of breath, it can cause cough, chest pain. It can also cause nausea, vomiting, abdominal pain, and some diarrhea. And not everybody gets those gastrointestinal symptoms, but they can go closely together, and really patients either go home and need very close follow-up, or they can get admitted to the hospital because it can be that severe.
Thank you. Dr. Wall, Stan in Duluth is wondering how come someone can smoke for years and never get disease, but others do?
Thanks for the question. That is exactly true. What we do know is that smoking is the leading cause of preventable death in the U.S. And in medicine, we're good in speaking in numbers, but ultimately it comes down to individual choices. If you smoke, you're going to live on average 10 years less than somebody who doesn't smoke. And there are a boatload of statistics. However, should you quit, if you're a male and you quit smoking before the age of 40, you have a 90% chance of avoiding some of the downstream effects. So it's never too late to quit. The sooner the better. And the statistics are different for men and women, but your risk of emphysema or some of the obstructive lung diseases, lung cancer or other cancers of the airways, and then heart disease are all orders of, at minimum 4 times higher, sometimes as high as 23 times higher of catching or ending up with those diseases if you smoke. So some people, the combination genetically or whatever other resources their body have, they're not going to succumb to that particular illness. However, the numbers are overwhelmingly in support of, if you smoke and you quit, the health benefits are astounding. So,
So let's say, speaking of quitting, I know that you all work for Essentia Health, and so some of you may be experts in what kind of programs they have to offer. But if a person comes to your office, say, and says, all right, how do I quit? What's the best way to do it? Would you like to comment on that?
There are best ways. We're talking about an individual at a day who needs to quit. There's many different ways to quit. There's obviously abstinence. You can try to quit, but that usually doesn't work. It takes the average person 7 or 8 times before they actually quit, if you want to use 2 quits in a row. And there's nicotine products, Nicotrol, which is basically where you control the amount of nicotine, and over time you taper down. It's a drug called Chantix, which works in a very different way. With the nicotine products, you have lots of different ways of delivering that. You can use a gum, you can use a patch, you can use an inhaler. All those things can work, and all those things can work for different people in different ways. I think the important thing too is, at least the organization we work for does have trained tobacco cessation counselors, which are available essentially around the clock. I believe there's 55, I don't even know.
About what I heard, 54 or 55.
A lot.
A lot.
Who are trained and committed to help people.
And have you heard anything about best practice with respect to, in addition to nicotine replacement therapy, working with a smoking cessation counselor?
I might not be able to get the statistic right. The sort of process we use is sort of the ask, advise, and refer. So bringing up tobacco use at every encounter with a patient, and then telling them that, boy, it would be great for your health and for probably your pocketbook and a lot of other things. We haven't even started talking about secondhand smoke and all the dangers of that. And then refer, so referring to, having that. Sometimes, like, we have the luxury in our clinic of having a real live person that we can literally bring in instantaneously to start the conversation.
Does that improve your statistical ability to quit?
Follow-up of any sort, I would have to look up I've got it written down somewhere. The more contacts and the more follow-up, I think, do certainly improve. I just can't tell you the amount that it does.
I think do you know we have a 6-month cessation success rate? Are you familiar with that?
No.
I think it's over 50%. If you work with a tobacco cessation specialist in conjunction with medication, it's amazing. It's very, very effective. Let's go back to the schools. There's some question here about kids. What can public schools do to educate students about vaping versus smoking?
Wow.
Go ahead.
Just
Beth, you could-
just to start with, again, the organization has, and education is one of the biggest things for both the parents and the students. And a lot of students have participated and been incredibly supportive and understanding the risks that, even when we look at tobacco 21 and increasing the age, the number of students, and I happen to reside in Hermantown, Minnesota, and the number of students that turned out for that to support that, and parents, and that there are resources, and again, CDC has those, and there are specific resources that are available not only for somebody who is who is vaping, but also for family members as well, and those different, and because we're trying to tailor treatment to individuals, and that's what we do for a lot of things, is to figure out what's going to help one individual.
I was at where you spoke on that to the City Council, and I was amazed at the reports from students about other students vaping in class, basically inhaling it and then putting their face underneath their coat or their sweatshirt and exhaling, and the smell of it in the bathrooms. What do you think about all these? In Britain, you mentioned they regulate it more. Do they allow you to have cotton candy scented nicotine and
My
strawberry?
impression is no, they don't allow that kind of marketing in Britain. It's just a different approach to the same technology. And I think certain places in the world were probably a little more savvy or a little more ahead of it, or just approached it in a whole different way. Just another thing on the nicotine, I think a lot of kids don't know there's nicotine in this stuff because you don't taste it. The way it's marketed, it's a nicotine salt, and so you can inhale it. It doesn't hurt your lungs. You don't even know and you can buy this stuff called vapeware, where you have a hoodie with 2 lanyards. You can have a vape on one side and you can have the pod on the other, so you can, and no one even knows you're doing it. This is what I've been told.
Right. When they don't know that there's 60 or 70 ingredients in there, not just nicotine, correct?
Right, and as Dr. Wall said, you don't necessarily know what's in the one that you're getting specifically, that there are not only the chemicals that can be in there, the amount of nicotine is much higher. It's hard to say how much higher, but it's probably closer to 2 packs a day of cigarettes. And if somebody is using 2 or 3 pods a day, that's a huge amount. And that awareness and understanding, the other thing that for individuals who are using marijuana in these, and knowingly or unknowingly, that's the vitamin E acetate component, that there's a chemical that has an association, and it may be in some of these that have marijuana, and that's one of the causes, that's one of the associations with severe lung injury. I think the other thing is looking at why do individuals start smoking, and at a younger age, there are things that people have. That's sort of the human body, that some individuals have a little bit more, they're a little bit more anxious, or it helps them feel better in some way, and helping understand why somebody is starting and trying to prevent that, and showing that there are other ways to help manage that, and how can you help somebody stop, is by helping them with that as well.
Not taking punitive action against the student, rather than go after the source of the tobacco or the actual manufacturer too. And just for, this is the, this little device right here, which I can, conceal in the palm of my hand here, has, over 2 packs worth of cigarettes of
Wow.
nicotine in this
Wow.
small little
And
pod, I believe it's called.
And it looks like just a flash drive.
Mhm.
So
Yeah.
it's concealable. The other thing is that amount of nicotine. So I also work with the Poison Center. And, they do get calls because the amount of nicotine is incredibly dangerous to young children.
It is very, and you were mentioning
Yeah.
seizures, and
Seizures.
it affects brain development. So there's a couple people here wondering, what can we do about this? Mary in Duluth and Randy in Duluth. Mary's comment is, how does the FDA work to change regulations in the United States? What do we need to do to push for more regulation? And similarly, Randy is, what should citizens do to demand a change from our political leaders to change this problem of vaping?
Well, I'd say first, I think what we're doing here is to talk about it and make people realize, because if our kids don't know about it, a lot of adults don't know about this either. And a lot of adults, as responsible people, it's our job to I think, start to spread this word. The only way it's going to change is by making sure that we tell the story, and that means individual to individual. It doesn't mean, I don't think, in a coercive way, at least on a one-to-one, but it means in a kind, caring, educational way, say this stuff is dangerous. Frankly, I think that legislation should be done that should have been more teeth. This thing that was just done by our president to basically, it was, instead of banning vaping per se, or banning products, or adapting what they did in England, you still allowed menthol, and this stuff is still going to be able to be purchased, the open tank stuff, so kids are still able to fill their pods, and there's no regulation on the amount of nicotine. So if you have often the response to an epidemic is to respond in a rather aggressive way, and I think that we should be contacting our legislature, because the health department knows about this.
Yeah.
There's no secret there.
It's your legislators.
It's just
you
your
need to contact.
legislatures you need to talk about.
Yeah.
Talk to.
Any behavioral changes due to smoking?
Well, certainly nicotine withdrawal, which is something that could come out in. You can imagine, we see it all the time in our hospitalized patients. They're either too sick to smoke, or hospital policy precludes them smoking. Irritability, disrupted sleep, maybe some cold-like symptoms, certainly some weight gain and appetite changes. But those would all be, I think, irritability, maybe a little bit of anxiousness. Those can all be classic symptoms of nicotine withdrawal. That's why we try to replace people's nicotine as soon as they get in the hospital with a patch, and then get them something short-term
I've
for
had
the
a teen
cravings.
say, I need to vape because it helps my anxiety, and I'm thinking, well, you're anxious because you're going through nicotine withdrawal as well. I mean, like you mentioned, it causes anxiety when that drug level goes down. Can anybody comment on what are the side effects of Chantix?
Should have read the package insert fully.
I've got a couple,
But traditionally, it can give you.
ideas.
Yeah.
First, some sleep disruption. Certainly, you can have. There's been some issues where people have had seizures and mental health issues related to Chantix, anxiety,
That's right.
for example. So, if you have a history of seizures or some mental health issues, it's recommending you don't use Chantix. And like you pointed out, Dr. Stevens, sometimes people smoke to relieve anxiety and other symptoms. So the drug can be effective, but initially, of course, when it was marketed, way back when, there were several people that anecdotally had said, had severe health effects related to Chantix. And so that has really I think in some ways decreased its utility over the course of the few years since it's been marketed.
Because the FDA, and that's always a good guide, has kind of three main arms of there's the varenicline, the Chantix, and I think I tell people they have strange dreams.
Strange dreams, yeah.
And there was a worry that it would cause increased suicidality, but I think that's been subsequently say no association. And then there's bupropion, our good old trade names Wellbutrin, and that's FDA. And then of course the just nicotine replacement. And you like to think of it almost like we do with diabetics. You get your long-acting, your nicotine patch, and then you take your gum or your inhaler, or how else can you? That's for your short-term cravings, and so those three methods.
We still have time, I think, for one more question. This, I believe, what the caller, it says, can bronchitis cause and exacerbate bronchitis in teens? I'm thinking maybe they mean, can vaping cause and or exacerbate bronchitis in teens?
I think so. It's a really good question, especially this time of year. So if somebody has, and bronchitis can be very short-term, sort of acute or chronic, and whenever you use an inhalation product, whether it's vaping or other substances, you can exacerbate that. You can exacerbate emphysema, things like that. But the bottom line, one of the sort of increased risks or increased potential complications is, for instance, if somebody is vaping and has an illness such as the flu. And how do you separate those? So it's an irritant to the lungs, whether it's regular cigarettes or vaping. Vaping has other things that are potentially really bad that can get down into the lungs and cause to the point where folks they really have trouble breathing. And the bottom line is yes, you can.
Thank you. Thank you very much. I'm sorry we have to wrap it up tonight. We're done with our time. I want to thank our panelists, Dr. Elisabeth Bilden, Dr. Jason Wall, and Dr. John Wood, and our medical students, phone volunteers, Wade Diostin, Amy Larson, and Alex Wooner. Please join me again next week for a program on allergies and skin problems when my panelists will be Dr. Michael Bayer, Dr. Patrick Brown, and Dr. Victoria Heron. Thank you for watching. Good night.